Healthcare is all about meeting the needs of a community, and data science can help meet those needs a little better. Specifically, when we talk about meeting the community's needs, what do we mean? Well, there are three major categories perhaps. The first one is identifying the needs. Second, it is about optimizing delivery, getting those needs met quickly and efficiently. And third, assessing effectiveness to see how well you're doing and see if there's ways that you can change the services to better meet those communities' needs. Let's talk about optimizing delivery and assessing effectiveness. When it comes to optimizing delivery, there's several aspects that data science can contribute to. The first one is in terms of just logistics. For example, coordinating the emergency department functions, so when a person arrives in an emergency room, there's a wide range of tasks to perform, including things like drawing blood, getting x-rays or ultrasounds, obtaining medication, and so on. Simply determining the order in which these tasks should be performed, not meaning always in the same order, but according to what's happening to this particular person, what else is going on in the ER, the time of day. Determining the order and matching the staffing, the resources, can also make a big difference. For example, some hospitals created a model to predict patient demand for each category of lab tests, by time of day and day of week. So, it's an optimization model. And the result is that they were able to reduce average patient wait time for lab tests by 75%, from 1 hour to 15 minutes. Second, there's operating room schedules. The ORs in the hospital are one of the busiest and one of the most important places in the hospital. They account for 60% of admissions and also 60% of the revenue of the hospital. But in most hospitals, the operating rooms are scheduled by phone calls, or faxes, or emails. That makes scheduling slow, and it's also awkward to make changes. For instance, when a surgeon ends up not needing the room for as long as he anticipated, they are actually also less likely to make those changes because the process is awkward. So this is an area that is ripe for tech. For example, UC Health in Colorado went through a relatively simple process of creating a smartphone app that could schedule the operating rooms. And they found that surgeons increased the number of scheduled blocks that they released by nearly 50%, and did so 10% sooner. And that freed up some of the most valuable resources in the hospital. One of the interesting elements of optimizing delivery is discharge planning. When a person has received the help they needed at a hospital, and it's time for them to leave. Simple problems like verifying their insurance, or even having a ride home can slow things down. Hospitals like MedStar Georgetown University Hospital in Washington, D.C., they developed models that helped them predict bottlenecks in discharge as soon as the patient checks in. This allowed to increase their daily discharge volume by over 20% and reduce the length of stay, that is the time spent just waiting to get out, by half a day. Again, an immense improvement in efficiency that allows the hospital to devote their resource to other people who need it, as opposed to people who are just waiting to get out of the building. There is also the matter of assessing effectiveness. How well is the hospital performing its functions, and can it do so in a way that's both more time effective and more cost effective? Well, there's several elements to this. One of them, for instance, is reducing readmission. Hospital visits are expensive, and while it saves money to not keep people there any longer than they need, it really is problematic and much more expensive to send somebody out too soon or with inadequate support. So they end up having to come back again for the same issue. There's also reducing health problems for premature babies. For instance, at some hospitals, researchers using high-frequency physiological data, such as heart rate and respiration rate, to create algorithms that can predict when a premature baby is at risk of infection and other health complications. Now, what's really amazing about this is these algorithms are able to identify the telltale signs of infection in changes in their heart rate, up 24 hours before the infection takes hold. This allows the hospital time to take preventive action and potentially save the life of the newborn. There's also the matter of reducing travel time for healthcare. Depending on where you live, you may have to travel for hours to see, for example, a specialist in a rare form of cancer, or even for something as common as reproductive health. Data science algorithms can help hospitals and clinics identity which locations are at greatest need for specific services, and also determine the schedules that would best match the availability of the people who need those services. You can also improve effectiveness by looking at something like, how well are your program reducing the waiting time to see healthcare professionals? Doctors' offices are notorious for long wait times. It would be nice if the patient can come in and out of there in 15 minutes. The system can use the information that you had given them previously, that they were able to gather information passively, that the sharing between organizations was seamless so that you didn't have to provide the same information over and over and over again, and that scheduling could be better coordinated so that there was less time waiting and lagging between. All of these things taken together, the ability to identify the places of greatest need, the ability to coordinate care effectively, the ability to assess effectiveness, all of these are ways that data science can help make the provision of healthcare more effective and really more beneficial to the communities that they serve.